How to spot a poor root canal before it's too late. I'm Dr. Olga Dolghier, Palm Valley pediatric dentist. I'm a board-certified pediatric dentist and laser dentist. Let's talk about root canals. A lot of people are concerned that root canals have systemic effect. Well, let's dissect this question. Number one, when do we need to do root canal? So root canals are done for adults and sometimes older children on permanent teeth only if there is nerve damage. So nerve is inside the tooth, we call it pulp. So if, for example, cavity was so big and that it went inside the tooth where the nerve is, you would experience pain, discomfort, and infection, and that adult or child will need root canal. When you do root canal, I would suggest to go to endodontist. Endodontist is actually subspecialty who has additional 2-3 years of training. Then they do only root canals. So they do it quick, they do it painless, and they have equipment for it. After your root canal is done, you should not experience any more pain. Your infection should resolve. If you had root canal done and you still have discomfort, pain, it just doesn't feel right, you should, and you, for example, did it in somewhere else, maybe not in endodontic office or even in endodontist, something is not right. Please go back to your doctor, double check that all the nerve tissue was removed, because sometimes the root canal can be overfilled when gutta percha or material which is inside canal goes out of the root, or underfill when there is some pathological tissue and necrotic tissue left out, or it was not filled completely. So in those two cases, or they can perforate the root, they can make a hole in the side of it. So there can be so many different things. The tooth can fracture as well. So you have to go back to the doctor, double check if everything looks okay. And if your doctor said everything looks great, if you still have doubts and still have symptoms, I would recommend again go back to endodontist professional who can do maybe 3D views. 3D imaging is something new in dentistry, and sometimes on traditional x-ray, especially with root canals, we might not see the full image of the tooth because some teeth are tricky. They have so many different canals, and if it's not properly done, an infection left out or some other complication can happen, might not be detected on the regular x-rays. And then you have to either do it again, that root canal needs to be redone, and then act accordingly. After root canal is done, you may have to have a crown. In children is different. So if we have a big cavity and the child has no symptoms, now we do direct pulp caps. Direct pulp caps is kind of removing just a little bit of a tissue where the cavity went in, and we put MTA. It's a special new material which actually kind of heal the tooth. So we're not removing the nerve of the tooth. So it's a new technology is now actually presented. In some roots might be still have open apex, those teeth, and there's additional procedures now we do which can actually heal the nerve inside, which done by endodontist. We call it epixification or epixigenesis. Epixigenesis is when we actually stimulate the stem cells around the tip of the root, and stem cells go into the canal from the inside. The apex is open and actually heals the tooth, and tooth does not need root canal. So there's so many new technologies and new methods, new research coming out for usually younger patients. When it's an adult, traditionally root canal is usually the way to go, and the stem cells may not be as effective. So there's so many new things. If the question comes up that you had root canal a long time ago, the tooth doesn't bother you at all, I would still recommend to take PA. PA is the x-ray which shows the apex or tips of the root, and make sure that there is no lesion, because even if root canal was done properly, for whatever reason, our body sometimes kind of starts rejecting the tooth, and then you will see the darkness around the roots. That tooth needs to be treated or removed. Sometimes endodontist will go in and try to remove the infection potential and remineralize the tooth or refill it again, or if it was done, I don't know, 20 years ago, then you might have to remove the tooth and put an implant, which is a good option nowadays as well. So keep an eye on those teeth which you had deep root canals treatment done even after years, because you never know how it's going to behave later on in life. Tell me please if you had any root canals done, how was your experience? Who did you go to see to have it done? Because endodontist is a specialty you want to see. Please comment below, let me know if you have any questions, and how did your root canal go if you had one. Thank you so much for watching. I hope you enjoyed it. I will see you next one. Dr. Olga Dolghier.